My name is Tamara Petrazzi. I am a physical therapist that does lymphedema treatment for the Alvin Rehab Center. So what I'm going to be talking today is something a little bit different than what we normally talk about, which is a lot of compression and hands-on therapy that we do at physical therapy. And I'm going to be talking about the nutrition aspect and what you can do more so, added extra things to help prevent, treat, and manage lymphedema. There's a lot more coming out now that they, through research that is proven to have, that there's a lot more that we can do for lymphedema, I think, than once thought of. And also there's a lot of links with nutrition that can help with lymphedema. So in order to understand, I think, how nutrition affects lymphedema, I think one of the best things to do is first just understand what lymphedema actually is, because lymphedema is different than regular swelling, so it's different. But basically what it is, it's an increase in interstitial fluid due to a lymphatic alteration. So the lymphatic system in your body is the system that helps with is part of your immune system, right? So it helps filter the blood, it helps filter that interstitial fluid. It just helps filter everything, and also helps maintain a healthy amount of fluid. You need some, but not too little, not too much. So it helps monitor that. And there's different types of lymphedema. There's primary lymphedema, which unfortunately you can just be born with. Just like any other system in your body, you can be born with a defect with it. So you can be born with primary, where your system is just not working properly. That's how you were born with it. Or you can have secondary, which is your system was fine, but then due to some sort of alteration, whether that be cancer or surgical removal or just any kind of, you could always just have an injury to it. You can have it through surgery or through an accident, and that would be secondary lymphedema. And what we do for that in physical therapy is something called complete decongestive therapy. And that consists of, depending on how intense the swelling is, bandages, compression garments, there's Velcro adjustable wraps, there's something called a Plexi-Touch pump that helps to also drainage, and then specific therapeutic exercises. There's also something called manual lymph drainage, which is a way to do a skin stretch to help move the lymphatic fluid. The reason why lymphedema occurs, even with injury to just one or two lymph nodes, I get asked that question a lot, because you have anywhere between 400 to 600 lymph nodes in your body. So a lot of times people think, well, there's one out, why should that matter? Because each one does its own specific job. So when one is out, you're still down a lymph node that was monitoring one spot. And that's why everybody that has lymphedema has it slightly a different spot. Even if it's on your arm, some people have it more here or more here or more here. So it depends which lymph node was removed, which of course has to do with where the cancer location was. So in addition to all of that, the topic that we're going to focus on today now is the links that they've also now done with learning how to, the links between diet and also weight control. So there is a lot of research out there now that is supporting that a healthy weight and diet can really affect lymphedema. So what we're going to do today is help explain that relationship between nutrition and lymphedema, and learn exactly what is good for it and then what is bad for it. So just as a first, just to start with an overall concept with nutrition, first is maintaining a healthy BMI, so body mass index. So before we dive into actual nutrition, just understanding that living a lifestyle that keeps you in a healthy BMI is also very important. So not just because of the actual nutrition itself, but also for your body weight. When you have too much weight on you, these are the side effects that occur, which then stresses the lymphatic system out even more. Because basically what's happening is that if you're dealing with lymphedema, it's already a system that's struggling to keep up. So you don't want to give it even more things. You want to give yourself then the best chance for it to function. So when you have an increased BMI, this puts weight on your diaphragm, and then you have an impaired diaphragm function. The reason why this is something that impedes lymphedema is because you have one of the biggest lymphatic ducts in your body actually runs through the diaphragm. So anybody with lymphedema, no matter where in the body, everyone's given diaphragmatic breathing. I tell people too all the time, even if you're not going to do any other exercise, at least do the diaphragmatic breathing. When you do diaphragmatic breathing, you make your diaphragm go up and down. And basically, you're just naturally going to move the biggest duct that carries lymphatic fluid in your body just by doing that. So when you have an unhealthy BMI, you're putting pressure on something that, as it moves, is helping the lymphatic system. So again, just another strain on a system that's already trying hard to work. It also increases intra-abdominal pressure, which is what I just also explained. Also, unhealthy BMIs usually reduces mobility and ambulation. Sometimes that then impedes your ability to walk. And the reason why mobility and ambulation is super important with lymphedema is because the lymphedema doesn't have a pump, right? So the cardiac system is with your blood vessels, your arteries and veins, that blood is moving because your heart is pumping it. Now the lymphatic system doesn't have that pump. So what it does is it lies through the muscles, and as you just contract your muscles daily with movement, it moves that fluid. So movement is very, very important for lymphedema. So staying stagnant lets that fluid pool. So usually if you have an unhealthy BMI, not moving a lot, you have that extra pressure on the diaphragm. Again, these are all things impeding the lymphatic system. Also, it can cause hypertension, and a lot of those medicines have side effects that cause edema. Increase cortisol and insulin, and it also increases the risk of skin infections. And if you get a skin infection, that increases fluid retention. So all those negative side effects also impede the lymphatic system. So now diving into a little bit more of the nutrition part. So then fine, so what is good for it? What is bad for it? What specifics? So I'm sure a lot of people have heard about antioxidants. That's very big. They've learned that free radicals are things that you obtain through certain foods that then attach to cells, and free radicals are known to do the things we don't like, the aging process and the breaking down of metabolism and slowing things down. And they found that things that are like antioxidants help to stop that aging process and also can help with your metabolism. So if you're struggling with just metabolism issues, antioxidants such as fruits, vegetables, lectin-free grains like millet, tea, coffee, and wine, those are just some examples of antioxidants that can also help some of those free radicals throughout your body and help decrease any kind of adverse effects on your metabolism. So now diving in a little bit further into the nutrition part with all of this. So there's different types of diets. One, I'm going to talk about two major different diets. One is an anti-inflammatory diet, and then one is a ketogenic diet. And there's different research out there now with people being on these diets and seeing if it does affect their lymphatic system. So not just are these, so basically by doing some of these diets too, you're getting all the health benefits of it, right? So if you're staying on these diets, chances are you're going to then have a healthier BMI, which will then reverse hopefully those negative side effects that having a higher BMI have. And then it also comes with its own list of help too. So it's kind of like a win-win situation with when you monitor what you're eating. So there's anti-inflammatory diets, and then there's foods that are known to be inflammatory. So anti-inflammatory diets, the reason why we are looking into this is that chronic inflammation in the body has been linked to lymphedema and lipedema. Lipedema is a different condition similar to lymphedema. It's when the lymphedema tends to pool more at the hip area, and it can be related a lot of times to very poor diet, unhealthy diet. When your body is in that constant state of inflammation, it causes that fluid retention. So there's definitely foods that we eat that actually will cause inflammation or help decrease inflammation. Swelling is also linked to fat deposit, not just fluid. And adipose tissue, which is the fat, releases cytokines and pro-inflammatory molecules. So that's just telling you basically that stored adipose tissue, which is fat, also helps cause more inflammation too, which is something we don't want. And there's a link between obesity and chronic inflammation. So just these are things then. So what do you eat when you're trying to do an anti-inflammatory diet? So these are diets that would be high in vegetables, fish, fruit, and omega fatty acids. Some examples of omega fatty acids could be chia seeds, avocados, and olives. And again, I'm not doing like an all-inclusive all list, but I wanted to at least give examples of everything so that you know, sometimes you tell people like, oh, an anti-inflammatory diet, but if you don't know what's anti-inflammatory or what's inflammatory, how do you know what to eat? Low glycemic carbs. So these are carbohydrates. So not all carbs are created equal, and some carbs are not that bad. Low glycemic means that they don't raise that blood glucose number too high. So something like quinoa, beans, and lentils. And then there's healthy fats that are found in wild salmon, herring, mackerel, eggs, olive oil, nuts, and seeds. So those are foods that you'd want to consume doing an anti-inflammatory diet. And foods that trigger inflammation, of course, a lot of them are the things we want, but these are the things that cause inflammation. So table salts and grains, then white rice or white potatoes, breads, pastas, pizza. Gluten is inflammatory. That's why a lot of people will be gluten-free even if they don't need to be. They just feel better off of it because it can cause inflammation. Refined carbs and sugars. Sugar is very inflammatory. Crackers, chips, cookies, sugary drinks, wheat, rye, and barley. And one of the things too, I just want to point out is that when we say sugars and carbs, a lot of it too is label reading too, because I think there's a lot of sugar in things that we don't even think there's sugar in. So unfortunately, sometimes I think we're just making the wrong decisions without even realizing it. But sugar is definitely inflammatory. So you just have to read labels and really look for things and try to find a lower sugar option to something if something that you are using has too much sugar. I think there's a lot of inflammatory foods that we don't realize, or just how much. For example, sometimes, people think, oh, it's one cookie or two, but if you read the labels, the sugar levels can be so high that it's still an inflammatory level. So that is a anti-inflammatory, versus inflammatory diet. So those are just some healthy choices to decipher, between, and the more you stay away from those inflammatory substances, the better, the gut health will be too. And so there's another link with then ketogenic eating. So anti-inflammatory dieting doesn't restrict no sugar, you're just limiting all that, but there's not necessarily a specific amount, right? And I think some people do struggle with that, but that would be where a nutritionist would take over if you wanted to know actual numbers and points and stuff like that. This is more of just a generic, these are the types of foods. But ketogenic eating is a way of eating with actual numbers and monitoring things. Because ketogenic eating is keeping your body in what's called a state of ketosis. And you can only achieve that if you maintain a certain lower level of sugar. That like there's no sort of doing it. You're either in the state of ketosis or you're not. So it's, you know, I guess a little bit stricter if you're doing it, guidelines than just overall watching or avoiding certain types of foods. So, but ketogenic diet, ketogenic eating has been linked to helping lymphedema. So that is why it is a health, you know, an option, or just an informative information, you know, just a healthy link between the two, if it's something that you want to do. They have actually done studies that link that this type of dieting, ketogenic dieting, help to actually form lymphatic vessels. So that's pretty big, because that's actually showing that it allows your body to get into a state that it's repairing it. So that's big, especially on a system that when you're in lymphedema, you unfortunately cannot reverse, right? We can just what we call maintain. Of course, sometimes we can get people to very, you know, hopefully very healthy systems still. So the fact that that's giving you the option to have formation of lymphatic vessels is big. The fact that you have the ability to do it. It is a very strict diet, though. It's a net carbs of 20 grams of carbs. So the way you count them, obviously you have to count them, because if you can't go above 20, you have to know what you're at. So it's net carbs minus the fiber. And there's also a lot, you know, because obviously I'm sure most people have heard of it before. So there's definitely a market towards it now too. So they, you know, they do make things that are the keto option of a lot of things now. I think this diet 10 years ago was a lot harder to do on your own, but just like anything, there becomes a market for it because there's products. So there's easier ways to do it. And there's basically like a point system that every amount or some sort of food equals a certain number. So it's something you could easily just look up to see what's what, if this is something you were gonna be strict about. It also helps reduce any fatty deposit in lipedema. So like I was telling you before, the lipedema can happen a lot from a very poor diet. So, you know, before we used to just kind of deal with what we were presenting with. So now with diet, you can actually try to help from within and prevent and not just treat. So it also changes the intestinal microbiome, and just a healthy reminder that if you do this, you know, do the diet, just make sure you still check that you're getting the right electrolytes and hydration when you're limiting that amount of carbs. And just like anything, there are always contraindications to every diet, and just like, you know, you should always talk with your doctor or nutritionist if you want to actually start following one specific diet. And because everybody has their own systems and other stuff. We're not just patients that have this one specific thing. You might have other issues, you know, cardiac issues or other issues. So these are just some things that are out there that a ketogenic diet wouldn't be recommended for. There's people that actually need carbs. There's, you know, there's always different diagnoses or things that people have that restrict their diet. So if you have other complications, of course, that's something you should always discuss with your doctor before using that just to treat the lymphedema, in case it's contraindicated by something else you're dealing with. So I'm going to now just talk about a case study. They did a study in 2007. This study was a randomized control trial, and what they did for this study, they just focused on one type of lymphedema. This was just a study done with breast cancer related lymphedema. Of course, that's not the only reason why people have lymphedema, but that's what this study focused on. And this was published and done in 2007. And they had 21 women, and everyone received treatment for weight loss, but they weren't testing the difference between how they got it. They were just trying to prove if the weight loss was significant, was also the lymphedema, was there a correlation between it? And with this study, with these 21 women, they did 12 weeks where some of the women got weight loss booklets and others got just healthy, others got dietary advice. So some got booklets, some got advice, but after the 12 weeks, with that information and knowing what to eat, what not to eat, they all had a significant reduction in body weight, and then they also had a significant reduction in arm volume. So the conclusion was that they all proved that with that 12-week study, with weight loss, that the breast cancer related lymphedema decreased significantly as well. So, you know, with the bandaging that we do, obviously that can help. And, you know, a lot of people don't find it comfortable. So, you know, what better way than to help decrease your swelling then from the inside out? And I'm not saying it's going to necessarily get rid of the need for compression, but you'll be a lot more comfortable if the arm is smaller from everything else that you're doing to help it. Okay. So another thing that was done was there is also a study done with intermittent fasting. So there is a lot of information out there just about it with weight loss. So number one, just the fact that it helps with weight loss helps the lymphedema, because as I talked about in the beginning of the presentation, having just a healthy BMI is important anyway. So all those benefits from just the weight loss always come along for the ride with this too. So just to explain first what intermittent fasting is so there's different ways that you can do intermittent fasting. So some fasting they're talking about is they're speaking about it as far as like the week, and out of the 7 days in the week you are eating normally for the 5, and then you're fasting for the other 2. Then another way is you can daily intermittent fast, which means you think of the time as not for the week, but you're thinking of the time as in a 24-hour day. And for example, this is just an example. You don't have to just use a 6-hour window. You can use different hours that work for you. But the point is that anywhere from 6, 7, or 8 hours is your time frame that you're allowed to eat. And then the other hours of the day you don't. So you could say that you start, so if you're doing a 6-hour window, if you start at 11 o'clock in the morning, then you have till 5 o'clock at night to eat. And then from 5 p.m. to 11 a.m. the next morning, you don't. So what it does with your metabolism and your digestion, the research has also helped that through using that, not just because of the BMI, but that also can help with lymphedema management as well. Okay, so a lot of the information that I got to, I took a class on the nutrition, but I just wanted to write the reference for that case study that showed the randomized control the randomized control trial of the weight reduction as a treatment for breast cancer related lymphedema, because like I said, that was published in 2007. And again, I know everyone that has lymphedema I know not every single person necessarily has breast cancer related lymphedema, but I know as far as my patients and clientele in the office that tends to be a a lot of them. So I think that's a very interesting study that actually to help prove all those things that that hopefully, you know, learning how to keep and manage a healthy BMI. So to learn how to just keep your weight at a point where you're not overstressing the lymphatic system. Learning, of course, the therapeutic exercises that we can always give you through therapy. And then, you know, the healthier you are and the more healthy your BMI is, like I said in the beginning, then hopefully the more you can move and walk around. And then another very good treatment for lymphedema too is walking, because as you're squeezing those muscles, you're squeezing the lymphatic system. There's different, so like I said, there's this very different types of approaches that you can do with nutrition. But I think what's important is just getting the word out there that it does affect it, and it can. You know, for a long time too, I think there wasn't that strong of a correlation, but now there is, and there's research and there's proof that, like I said, not just with the BMI, but keeping a healthy gut, keeping a healthy anti-inflammation in your system, all of that affects and helps either help or hinder the lymphatic system. So yes, you know, compression is still important, and we're going to keep doing manual lymph drainage. We're going to keep, you know, we'll keep bandaging people, and the pumps are helpful, and all of those things are helpful. But if you can give yourself the best chance to get the system, it just will let those treatments then work even better, and it will help not fight then what we're trying to do with the wraps and the pump and the manual lymph drainage. And also, I think it's important to get the word out to start all this too, like as soon as possible. I think sometimes, you know, with lymphedema, the real important thing is that they've learned through the years is really trying to get the prevention out there. Unfortunately, it's chronic once it becomes it. It's a type of system that has a threshold. So you don't want to pass and then enter into that threshold. You rather learn how to prevent. And so if you know you're at risk for it, what better way than to help prevent it through being by doing these diets, giving your system the best it can, and of course, like I said, everything else through therapy as well. So that is what I wanted to go over today. I wanted to just go through those different types of diets and also give examples, because I think sometimes people just say, oh, do the keto or do inflammatory, or anti-inflammatory, but some people I think want more of a direction. And I also wanted to show the evidence that there's proof that it does help and explain why. I think sometimes when we understand what we're doing with the system, it makes more sense than we do it more because we know what it's doing. But yeah, I'd like to open it up now if anybody has any questions for me. Oh. I don't know if I can see if anyone's writing in the chat, but if anyone wants to go over any questions, you're welcome to unmute yourself. Oh, let me see if I can see in the chat. Okay, I apologize. I just figured out how to see that. So let me go back to the first. Oh, okay. Someone asked if it would be available at a later time. I think it is being recorded, so I'm assuming so. And also, I'm happy to pass along the PowerPoint too. I can find out maybe how I can get that out as well. I'm assuming if it's being recorded, we might be able to get this out too. Oh, thank you, Emily. You already wrote that. I'm sorry. I'm behind. I wasn't looking at the chat. Okay. The impact of salt. Okay. So salt is, I don't know the exact correlation, but basically with salt has to do with fluid retention, and it affects your fluid because, so someone asked in the chat, what does salt have to do with it? The reason with salt is we use fluid to either dilute or undilute something. So fluid is moved around depending on how much salt you eat too. So there is a big correlation between swelling with salt because like I said, your body just uses fluid to help monitor. So if you have too much, then you have to move the fluid to try and dilute that. But I don't know numbers though exact. Like I don't know if, like, I know the sugars and the carbs for the ketosis, but I don't know if there's like a certain amount you're supposed to keep under though. I just know it does, it can put strain on the lymphatic system because of moving the fluid. Okay. Someone wrote the list of inflammatory products. I think you mean like the inflammatory food, the anti-inflammatory. So I think that, so there were examples under the anti-inflammatory diet. Well, these are examples for the antioxidants. And then the anti-inflammatory diet, here are some of the examples of the omega fats. I don't know if that was written before this slide, but of what you can eat, the low glycemic carbs, and then the healthy fats. Are all physical therapists trained in lymphedema? No, not every therapist does lymphedema. It's a specialty that we do after we graduate. You would have to ask if you want to get a lymphedema treatment from a physical therapist. It's just called a certified lymphedema therapist, CLT. The letters under my name are certified lymphedema therapist. So if you called an office, that's what you would ask for. At the Alban Center, we do have lymphedema therapists at many different sites. But yeah, you would have to specify that if you wanted lymphedema treatment. Oh, yes, please. That would be great. I just saw from Sarah. Do I have to take you off mute? Oh, Emma, I think Emily's doing it.
Can you hear me now?
Oh, yes.
Oh, hi. Hi, everyone. Great talk. This is Sarah Lombino. I am the clinical nutrition manager at Bridgeport Hospital, and a few of my dietitians are also on this call as well. I just want to point out that we do have a registered dietitian that is certified at Park Avenue. We also have other outpatient dietitians that can see patients as well. So I urge anyone, if you would like to try any of these diets or haven't any more further information, wanted further information on any of this, please reach out and we can collaborate with the team on this because it's great information. We just want to make sure everyone is following the diet safely and it's fit for them as well.
That's awesome. Thank you, Sarah. Yes, definitely. Always, like I said too earlier, like different, you know, we don't just have one thing. We have other things going on in our bodies, and it's always great to get then specific help. This is just to give a general idea that as physical therapists, we do the compression and the manual lymph drainage, but just to help turn the table on learning how to also take responsibility for managing from the inside out. But that's great, and thank you, Sarah, for adding that. I appreciate it. And maybe since you're on too, I don't know if anyone can answer this question, because I don't have the answer to this. Somebody wrote that they were prescribed Ozempic to lose weight. Will it help with craving carbs? This is out of my scope of practice. I don't know that answer. Does any nutritionist, are they able to speak to it, or is that something that maybe the doctor has to answer? Because it's a medication, so that might be.
Can you repeat? What was the question?
It said, someone said, my doctor prescribed Ozempic to lose weight. This will help with craving carbs. It's asking if it will help with craving carbs. I don't know about Ozempic. Ozempic is, I mean, I've heard of it, but it's not in my scope of practice to know of it. So I don't know about that.
Yeah, I'd have to look it up myself. I'm a little rusty. But that's a great question, and that's something that our dietitian,
Yeah.
I think in general it does help to reduce appetite. So I'm thinking that might go along with helping to reduce the cravings of carbohydrates, but that's something that we could, if we could reach out to the dietitian, that's a great question to ask as well.
Hi, can you hear me? This is Hannah.
Yes, hi.
Hi. So yeah, my name is Hannah Caradad. I'm the dietitian nutritionist at for Smilow Cancer Center in Trumbull. And I mean, Ozempic is a very new drug, and I have had a lot of patients come to me, and their doctors have put them on it. The research is very new when it comes to semaglutide, which is the generic name for Ozempic, or other medications like Mounjaro or Wegovy. And honestly, I mean, I think I see very similar things with the keto diet as well, that the weight might come off very quickly initially, and you might have less cravings for carbohydrates in the short term, but in the long term, it's not that sustainable. So that would be something, again, that is kind of case specific, but I would really talk to your doctor about it.
Thank you, Hannah. I appreciate the input. And maybe if I can just make a friendly suggestion, not looking into the lower glycemic carbs, or I don't know exactly what the cravings that you're trying to fight off, but if maybe something that wasn't as high in it, if that could, that's just a suggestion. Because that was one of the things, I mean, again, this is more than I think where a nutritionist would take over in discussing, I think, the more specifics of which carbs are healthier.
Yeah. Can you hear me still? Sorry.
Yes.
Yeah. So, the registered team of registered dietitians, I'm the only one at Park Avenue, but the registered dietitians are pretty, we're the experts in the nutrition kind of field. So, if you have any questions about, trying to get more satiating carbs and, kind of less of the refined carbohydrates and more protein as well, I think that is something to be considered also. So yeah, definitely reach out to a registered dietitian if you would like to know more about nutrition.
Yeah, thank you, Hannah. Pretty much how I have the slides is for me as in depth as I get. For the specifics, I definitely agree that seeing a nutritionist for the actual, if you want a little bit more catered to your specific needs, definitely see about talking over with them. If one of these diets speaks to you, or you're very interested in now actually putting it to use, for the specifics, I would then defer to a nutritionist. And as a PT, I'm going to also try to just be more conscious of it, to even just refer to nutritionalists, just to bring up the point that it's important, and then refer out to the nutritionist.
Tamara, may I just, it's Sally.
Hi.
You did a great job. Thank you so much for
Oh,
doing this
thank
for
you.
our patients. I just wanted to let everyone know that our great dietary team is going to be doing the education program for April. So please look at the flyers that were sent. Hannah, who was just on, is going to be presenting that program. And so you'll have an opportunity to talk to her as the dietitian for Smilow. So thank you so much.
Thank you. Yeah, and thank you for adding that in. Yeah, Hannah will, I think, take over then for the April one and probably answer then more specifics on the actual like nutrition and numbers and that info for April. Does anyone have any other questions? For physical therapists, you need a referral from your doctor. Yes, you do in order to get physical therapy, and it can be any doctor or nurse, and it doesn't have to be if you're if it's an oncology patient. It can be a primary doctor. Any doctor can put it in, and then just put in the code for lymphedema, and then we can start from there. But yes, a doctor does have to do it. Does insurance cover compression sleeve? It depends on the insurance. Some do, some don't. That's something we would we either look into for you, or you can always call your insurance company yourself and just say, do you cover compression garments? But we can also look into that if you need help for you too. But it's insurance specific, and some of them have different answers. Some are yes, 1 a year, 2 a year, or partial. There is a website called lymphedemaproducts.com. So it's www.lymphedemaproducts.com. And you can buy your own if you felt that you were able to know, or you felt the size. Some people don't feel comfortable doing that, but just to let you know, there is a website. You're welcome. Someone can just buy it. You don't have to. The reason you could do it through another store is to have your insurance pay for it. Let me see someone else. So someone wrote, why do I crave sugar after lunch or dinner, or what should I do to change it? I might ask for help from a nutritionist that's on this about craving sugar. I'm not sure if that's something, is that something in time that if you stay away from, do you feel that people stop craving it over time? Or is this, does a nutritionist want to?
Yeah, I'm here. Can you hear me?
Oh, thank you.
Yeah, so this is Hannah again, the dietitian. I'm just going to correct you. It's nutritionist or dietitian.
Oh, thank you.
You're welcome. But so things with sugar cravings, generally what I see is that when patients aren't eating enough in the morning time, whether that's they're not getting enough fiber, they're not getting enough healthy fats, they're not getting enough protein in the morning and at lunchtime, that they tend to want to snack on more sugary things, maybe after supper or in the afternoon. And that's kind of where we get that that fatigue. And it actually is caused by under eating. So again, like I would suggest that following a more consistent eating schedule and trying really hard to get that protein in and making sure that you're staying hydrated as well can be really helpful in kind of avoiding or lessening those sugar cravings. I know that a lot of the time too, we have, very stressful days, stressful times at work. And that can also, kind of play into things as well. So getting some movement in, making sure that you're treating your body well can also help to lessen those cravings for those kind of sugary or very calorically dense foods.
I don't know if you can see, but she said thank you, Hannah. I think I'm the only one that can see it because I'm the host, but she said thank you. And then Oh, and someone else just wrote that they're doing therapy now. It helps a lot. Still have pain, but now they can connect the reason. They have to change their diet. Thanks for the meeting. And you're welcome for the meeting. I'm glad that, and again, I hope this just starts the eye-opening process of understanding that it does affect it, and that it's proven to, and like I said, to the very beginning, just overall, even just keeping that healthy BMI, and takes a lot of strain off the system that you might not have realized you were putting on it. So again, struggling system, the less we strain it, the more it can help function. I just want to make sure I did. Okay. Are there any other questions or add-ons that anyone wants to add? I don't see any other new questions. Anything else that anyone wants to add? Oh, so thank you. You're welcome.